Hi, welcome to Type 2, where we discuss everything about Type 2 diabetes in a way that everyone can understand. Now, today we're going to talk about a class of medications that make you urinate the extra glucose in the urine, in the toilet. Now, these medications are being used a lot lately for Type 2 diabetes. On my last video, I told you that there are different kinds of medications used for Type 2 diabetes. And on this channel, we're going to talk about all of them. But today, we will look at these ones that we call SGLT-2 inhibitors. Now, I chose these ones first because we already have a video on why high blood sugar causes frequent urination. And these medications do just that, so it's easy for you to understand. Now, if you should take medications, it's between you and your doctor. But my goal is to explain to you clearly how they work, so that you can understand some of the pros and cons of taking medications. Now, there are many of these SGLT2 inhibitors. We have Canagliflozins, Empagliflozins, Dapagliflozins, and whenever you see some random letters followed by gliflozins, you know that we're talking about SGLT2 inhibitors. Now, how do they work? In my video about why high blood sugar causes frequent urination, I told you that your blood, including the glucose in it, has to pass through the best filter in the world, your kidneys, more than 20 times a day, right? And I told you that everything in the blood, except some big molecules like proteins and some cells and things like that, everything else has to pass inside this long tube that will make urine. Now, you have two kidneys, and inside of each one, you have about 1 million of these small filters. Now, the blood with all the waste products and other things, including glucose, will come inside your kidneys. Then let's zoom one of these. It will come inside, and on the way to make urine, I told you that everything that is important to the body will be taken back. At the end, only the waste will come here, And I also told you that glucose is on the VIP list. All of the glucose that will pass here will be taken back because there are transporters of glucose called sodium glucose linked transporters or co-transporters. These are SGLT2 and SGLT1. These one, whenever glucose is passing by, these transporters will take the glucose back to the blood. And I told you that if your blood sugar is not too high that, these transporters are overworking or something, you cannot find glucose in the urine because there are transporters of glucose that will take all this glucose back to the blood. And there will be no glucose here going to the toilet. Now, someone said, wait, if you have high blood sugar, the sugar is not always in your blood. It's actually going outside and then coming back. So why don't we just close the door? And this is exactly what they did. So when we talk about medications, if you don't study medicine, you'll think that medications are some crazy things, people invent, but they're not. They're just some easy manipulation, or I don't know how you call it. In this case, we know that glucose is leaving the blood more than 20 times a day. So someone said, why don't we just close the door? And that is exactly what they did. They made some things that we call medications that when you eat them, they will go all the way to your kidneys. And these medications will come all the way here and block these transporters that are supposed to take the glucose back to the blood. Now, we have transporters 1 and 2, but most of them are transporters 2. About 90% of them are transporters 2. So that's why we block this one. Now, what happens when we block these transporters? The glucose will come normal, they're going to the urine, and there are doors for glucose to come back, but the doors are closed. So the glucose will keep going and will start to appear in the urine. Very easy to understand. Do you think this is a good or a bad idea? You know, every day your blood glucose is high, you have high blood sugar, and you take these medications, they block the transporters that are taking the glucose back to the blood. So whenever the glucose comes out, dun, 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 nope, can't get in, dun, dun, no, no, and they will go to the urine. Some of them will take this one, of course, transporters one, but they're not many. So at the end of the day, you will have a lot of glucose going to the toilet. So do you think this is a good or a bad idea? I know maybe some of you will say good, some will say bad, but at least with this understanding, you will know some of the pros and cons of these medications. The first good thing about these medications is that, as I told you, the glucose, sugar, is leaving your blood. Now, that's important because if you have high blood sugar and you take these medications, you are wasting this sugar. You are wasting glucose. You are throwing it away. For example, when we compare that with something like insulin, you know that insulin will make the glucose leave your blood to enter into different cells, right? And the glucose will be used for energy or be stored as glycogen and fat. So when you take insulin, you are feeding your cells, right? But when you take these medications, you are feeding the toilet. I mean, not feeding, but you are wasting the glucose. Here, you are feeding your cells. And, people who take a lot of insulin tend to gain weight. But with these medications, because you're wasting glucose, you will tend to lose weight. So patients that take these medications, their body weight tend to go down, not up, like insulin. Now, I think it's a good thing. No, you might say that financially speaking, this is a disaster because you're buying food and then you're buying medications to get rid of the food that you're buying. But, this channel is not for financial advice. Physiologically speaking, this is a good thing. It's better than insulin in this aspect. Now, another thing about these medications is that, well, I don't need to tell you that they reduce your A1C, right? Because you're losing glucose and your A1C is the average blood glucose for 2 to 3 months, which means that with these medications you will reduce A1C. Your A1C will go down. Even your fasting blood glucose will go down. Your post-meal blood glucose will go down. Now, what do you think that will happen to your blood volume if you're urinating all the time? Now, I told you that more glucose will come here. And know that water in your body can freely move from lower concentration of solute to higher concentration of solute. If there's higher concentration of solute, like glucose and sodium and other things, outside, water will come to balance the concentration of things in your body. So more glucose here means more water will come and more urine will come. So with these medications, your blood volume will tend to go lower, to reduce. Now, is that a good or a bad thing for people with type 2 diabetes? We think it's a good thing because a lot of people with type 2 diabetes also have high blood pressure. So with these medications, your blood pressure will go down. Lower blood volume means lower blood pressure. Let's say your heart had this amount of blood to deal with. Now it has this amount of blood to deal with. That will put less stress on your heart, on your blood vessels, so you will have lower blood pressure, and your heart will also have to work less. That's why patients who take these medications, they tend to have less heart problems because of these medications. And even reducing A1C and weight and other things can also help your heart. But these medications can help your heart better than a lot of other medications for type 2 diabetes. Now, there's one more thing that we can say that is positive or negative depending on how you take it. The chance of having hypoglycemia with these medications, the chance of having low blood sugar with this medication is low. Because as I told you, you only block SGLT-2, right? You only block these ones. But there's still 10% of SGLT1s that can still take glucose. So, which means that when your blood sugar is low, these ones are still taking it. And if the blood sugar is low, even some of these SGLT2 will still work, will take some of the glucose. And then another thing is that when your blood glucose goes down, your pancreas will release glucagon. And glucagon will tell your liver to make some glucose. So it's not likely to cause hypoglycemia like some of the other medications. But this can be good or bad because it doesn't reduce your blood sugar too much. So when you talk about A1C reduction, we expect a mild A1C reduction. So most patients will not take only these medications. They will have something else, or they will have diet and exercise include, or insulin, or some other things, but not just these SGLT2 inhibitors. But some people, especially people that were taking too much glucose back to the blood, these medications can do wonders. Like they will take them and it works fine for a long time. Now, what are some of the real causes of these medications? The first one is that they cause infections in your urinary tract and your genital area. And the reason why that happens is that first, you're urinating all the time, which means it's harder to keep that area clean. And the second one is that glucose is energy. Glucose is food for the things that cause infection. Even when we try to grow cells in the lab, we give them glucose so that they can grow faster. So these medications increase infections, especially for women. Men too, but more women than men in this case. Another problem with these medications is that they can cause ketoacidosis. Now, the risk is actually not that high. The risk of getting ketoacidosis is not that high, but this condition is serious enough, so I think you should know. Because when you throw all this glucose away, and let's say you are someone who had ketoacidosis before, or you are on a very low carb diet, the very few glucose you're putting in, you're throwing it away. Or someone who's fasting or doing some ketogenic diet, or you're under severe metabolic stress, like if you just had a major surgery or something like that, you should talk to your doctor about these things before you take these medications. And for some people, some of the advantages of these medications can be disadvantaged. For example, I told you that your body weight will go down, right? But if you are someone who is underweight and does not want to lose weight, this can be a problem for you. And the same can happen with blood pressure. If your blood pressure was already low before these medications, it can be a problem. So it depends. Now, before you go, after understanding how these medications work, when you compare them with something like diet, which one do you think is better? For example, let's say you cut all the refined carbohydrates from your diet. Now, your blood sugar doesn't go as high as before. Maybe before you used to go like this. Now maybe it's here, right? Or you're someone who doesn't want to change the diet and keeps the blood sugar high, but buy these medications to throw them into the toilet. Which one do you think is better? For me, diet comes first and exercise second. And all these medications, including this one, that gets rid of the glucose, even though it's an expensive way to deal with it, but at least they don't cause more problems to your diabetes. They come third. And then some other medications that cause problems to your diabetes, that make you gain weight and other stuff that we'll talk about later. And then the last one is those that do nothing and just wait for complications. So, you have choices. I hope this gave you a good idea of how these medications work. Have a blessed week. Bye.